So welcome everyone to Trillium Health Partners. My name is Michelle D'Emmanuel and I am the President and CEO of Trillium and honored to be so. I'd really like to welcome our Deputy Premier and our Minister of Health, the Honourable Christine Elliott, a good friend to this hospital and to the system, and also to our Parliamentary Assistant, Robin Martin, who I've had the pleasure of doing some work with along the way as well, and to our members who are also joining us here today. We serve the community of Mississauga and West Toronto and the surrounding areas, and we know that things are changing, and like a number of hospitals, we are also experiencing great demand for our services and growth as well. And today we're going to hear about an important announcement that the Minister will be making that outlines their plans as a government to deal with a digital health strategy. And as we know, this government, along with us in the system, are really reimagining how best we can deliver services into the future, and I believe today's announcement is a step forward in that regard. I'm also pleased to see many of our physicians and staff who've been advancing our own digital health footprint here at Trillium Health Partners, and you'll be hearing more about that as we see our demonstration today. You know, technology is often either feared or embraced. And I know in our own lives we think about how we can use technology sometimes to simplify some tasks that we may have in our life, like ordering our groceries. And other times it can be also used to really make our lives so much more functional in what can be sometimes complex situations, like the use of robotics and AI. So today's announcement comes at a time, I believe, when healthcare providers and patients are looking, in fact, for more interconnected and seamless care, and one that really helps to improve not just the service, but help to improve the environment for their lives and how they go about functioning on a day-to-day basis within that system. Minister, I'm so pleased to tell you here at Trillium Health Partners, we've been a leader as it relates to digital health, and our work in that regard has really commenced some almost 6 years ago when I think about some of the first work we did in our mental health program. And we've gone so much farther than that since then, and I believe your announcement today is going to help us go even further. And so with that, please welcome the Honourable Ms. Christine Elliott.
Well, thank you very much, Michelle, and good afternoon, everyone. It really is a pleasure to join you today, along with my colleagues, Robin Martin and Rudy Cazzetto. And I'd really like to thank the entire team at Trillium Health Partners for hosting us today. Every day, the team here at Credit Valley Hospital delivers compassionate care that puts the needs of the patient first. And I really want to tell you how grateful I am and express my appreciation to everyone here for the great work that you're doing. Now, as everyone knows very well, we made a promise to Ontarians that we would put an end to hallway healthcare. We do have a comprehensive plan to do so, and it is a plan that has 4 pillars. First, we want to keep Ontarians healthy and out of hospital. Not surprisingly, we call this pillar prevention and health promotion. Second, our plan will ensure that Ontarians receive the right care in the right place. While in many ways the backbone of our healthcare system, the hospital is not always the best place for a patient to receive care. And I would say that especially at a time when so many of our hospitals are operating at up to or over 100% capacity. Third, we are better integrating care to improve patient flow. Doing so will help to ensure that those patients who are able to leave hospital can do so with the right care and supports in place around them when they return home. And finally, by investing $27 billion over the next 10 years in hospital infrastructure projects, our plan is putting capacity throughout the system, including in hospitals and other community-based care facilities. As part of this plan, we are taking a digital-first approach to modernizing our healthcare system. In doing so, we can help ensure that patients across Ontario receive the right care in the right place, including in the comforts of their own home through advances in digital technologies. Indeed, through the introduction of secure digital health solutions, we aim to change Ontarians' experience with our healthcare system in ways that will benefit those who receive care, those who deliver care, and innovators who are looking at how to improve care. So that is why I am very pleased to announce the first phase of our government's Digital First for Health strategy. Based on extensive consultations, this strategy will expand and improve access to virtual care, provide more options for online appointment bookings, and improve access to data for Ontarians and the people who provide their care. Once our strategy is complete, it will allow our doctors, nurses, and care providers to have connected digital tools and data integration. It will also help us identify opportunities for more effective care delivery. These secure digital health solutions will fundamentally transform and modernize our healthcare system to help end hallway healthcare. As we get started, the first phase of the digital strategy will provide Ontarians with more choices in how they interact with their healthcare system and allow for easier access and control of their own health information. As part of our new strategy, we are going to make virtual visits more readily available to patients. Imagine being able to have an appointment with your doctor while in the comfort of your own living room. With this technology, patients will be able to see their doctor or care provider through secure video visits. Now, patients will, of course, still have the option to see their providers in person, but in fact, this first phase will increase the availability of virtual care with approximately 55,000 more video visits. To do so, the government will invest $3 million in new funding to compensate physicians for the video visits that they are now going to be able to provide. Virtual video visits will enable doctors and care providers to offer patients more ways to get the care that they need. And it will give patients more flexibility in how they access care. The first phase will also enable Ontario health teams to collect, use, and share information to allow for better patient care and outcomes. This will improve convenience for patients and promote more connected care by ensuring patients won't need to continue to tell their healthcare story over and over and over again. To achieve this, we are proposing changes to modernize the Personal Health Information Protection Act. These changes would enable the introduction of standards for digital systems to exchange information and to better protect personal health information. These important measures are designed to ensure that patient privacy is respected and, of course, maintained. In fact, we are also introducing stricter provisions for any individual or organization that misuses personal health information. These include making it an offense to re-identify someone by using their health information after personal identifiers have been removed. Also, it helps protect personal health information by allowing the Information and Privacy Commissioner of Ontario to order her personal health information returned if someone contravened HIPAA, and making it easier to start a prosecution for someone who has allegedly made an offense by allowing the Attorney General, as well as his or her agent, to agree to start a prosecution in order to ensure that privacy for personal health information is respected and maintained. This is just, of course, the beginning. As we roll out our strategy, patients will have even more new options. They'll be able to book their appointments online and be able to review their health information online as well when and where they need it. This will enable patients to make informed choices about their care. And because our strategy calls for better system integration, patients and healthcare providers will be able to access patient records stored in many different offices. For example, your doctor may be able to see important information from your visit to a specialist. As we integrate care, the patient will be informed of who sees their health information and provide their choice and consent when it's needed. As part of this process, our government is ensuring patients have appropriate control of their own health information and can provide their consent as to how it's used or shared. Our Digital First for Health strategy will also harness the imagination and capabilities of Ontario's digital health innovators to improve care for all Ontarians. Innovators will have more opportunities to engage with the local health system and know the standards and policies to create meaningful products that would best meet the health system's needs. For example, through our strategy, we will adopt clear, privacy protective standards for information exchange, virtual care, and clinical decision support tools. This will allow the market to better respond to the needs of our healthcare system and make it easier for businesses of all sizes to compete in Ontario's digital health economy. At the same time, providers will face fewer barriers to integrating and using health information to manage health resources and, of course, improve patient care. This could lead to improvements such as earlier intervention and better management of chronic diseases. By introducing virtual video visits and other digital innovations, our government is providing patients with more choice in how they access their healthcare system. We are focusing on patient experience and better connected care in order to reduce wait times and to help end hallway healthcare, while, of course, ensuring that patient privacy remains first and foremost protected and maintained. In a moment, we will showcase the benefits of virtual visits and demonstrate how we can better integrate our system through a live demonstration. Together with Dr. Zohei Syed, we will be connecting with Trillium Health Partners Reactivation Care Site, and after which I'd be happy to take questions from you. But every day, Trillium Health Partners leverages the power of technology to connect doctors here at Credit Valley or any of the hospital sites with patients and nurses at the reactivation care sites. This is an innovative and cost-effective solution that ensures the delivery of high-quality care exactly where and when their patients need it. Not only that, it is exactly the sort of 21st century innovation that our Digital First for Health strategy will bring to every region of the province. So before we do so, I would be happy to take any questions from the media on the announcement that we've made today.
People can come forward to the microphone if that's possible. Are there any questions? Okay, that's okay. Yeah.
Minister Elliott, Martin Traynor on CBC on behalf of Mike Crawley. The Ontario Hospital Association says that hospital occupancy rates are at record highs right now, and they say that's a bad sign heading into the flu season. So what's the government's short-term plan to improve hospital capacity this winter?
Sure. Thank you very much for the question. And certainly we know that many hospitals are exceeding 100% capacity. This has been the case for a long time, and it's been years in the building. This isn't something that just happened within the last few months. That said, we have been working with hospitals across the province. We've been working with the Hospital Association and with the Home and Community Care Associations. They are working together in a way that hasn't happened before because they want to work together to make sure that as many people as possible are able to be maintained safely at home if they come into contact with the flu. Some patients will need to be admitted, but we are really working with the Home and Community Care partners. We put $155 million more into Home and Community Care this year to allow them to do that sort of triage to allow people that don't need to be admitted to hospital but do need some kind of care to be maintained at home with the healthcare support supports that they need. We also have opened the reactivation care centers, which we did last year in anticipation of the flu season coming upon us. And many patients who are alternate level of care, who may be waiting for long-term care, are going into those reactivation care centers. There are going to be more beds that are going to be available in those care centers. And I know that individual hospitals are also working on their own solution to expand so that they will have more beds available. And I don't know, Michelle, you may want to say something about what's happening here at Trillium Health Partners about what you're doing in anticipation of the flu season.
So maybe just to echo what the minister said. Just to echo what the minister said, we've been working with the ministry for many months now to get ready for this upcoming season. So, for example, we opened up our reactivation care center. We're adding a further 40 beds in December, which will assist us as we go into this year. And we've already begun planning with the ministry for next year as we get ready for the season.
So you're not concerned with the increase of patients then that will be happening during the flu season?
Pardon me?
You say you're already taken care of for the...
We have been planning for this for some time, and so with the help of the ministry and those plans that we've been putting in place, we will have this winter additional capacity on ready to go as of December.
Okay, very good. And maybe for the minister again, just to follow up on that. So why has hallway healthcare problems become worse over the past year rather than better?
Well, actually, we have done better than expected in the sense that if we hadn't put some of these processes and plans in place, we would have far higher levels of hospital hallway healthcare than we have right now. So we have basically maintained the levels, which isn't perfect, I know, but it could have been far worse than it is now. Of course, right now, what we're trying to do is to lower that number and eventually eliminate it. So there's still more work that we need to do, but we are acting on a number of fronts in order to make that happen. And I think as we're speaking about the flu, I don't think I would be properly doing my job as health minister if I didn't mention that prevention is probably the most important factor. And so I would urge everyone here in this room, if you haven't already done so, to please get your flu shot. And please speak to your friends and neighbors about it, because it protects you against the flu, but it also helps protect those people that you care about from the flu, especially people that may have very delicate immune systems. So prevention is a key part of our strategy.
Okay, thank you, Minister.
Thank you.
Thanks. Are there any other questions? Okay, thank you.
All right.
The virtual care.
Thank you. And with that, Dr. Syed, shall we connect? All right, please.
So I'm going to sit because I usually sit when I do this.
All right, please.
So I'm Zoe Syed. I'm the Division Head of Complex Continuing Care, Rehab and the Reactivation Care Center here at Trillium Health Partners. And I'm just going to show the Minister how we use virtual care here. We use it every day, and today we're going to be calling the Reactivation Care Center. I've been here for 7 years, and we've been building up our virtual care capacity each year. So this is a new and exciting thing that we've been doing since earlier this year. So normally what we do is we bring up the OTN screen, the Ontario Telemedicine Network, and then I'll connect with Amin. So I'm going to go ahead and place a call. Hi, Amin.
Hi, how are you?
So this is Amin Banwait. She's a nurse practitioner that works with us at the Reactivation Care Center.
Okay.
And so normally what we would do is we would connect, and then I would speak to her about the patients that we were going to see. And then, what would we do from there?
So yes, we will discuss our schedule for OPN for that day. We'll review their chronic diseases, how we're optimizing their medication. We'll go over any recent diagnostics, blood work, and we will go in and assess the patient. At that time, I will perform a physical assessment on that patient. And there is an opportunity for the patient and the families to ask any questions that they have for the physician. And then we will develop a collaborative care for the patient.
And so that's why I really love virtual care, because it allows me to have a presence in places that I normally wouldn't. Families know that we're going to be there, so we're able to be a part of it. And, not just at the reactivation care center, but we may be able to go to patients' homes or other care environments. We've done long-term care. We're trying to do many different areas where we can allow physician access and other health professionals to access places they normally wouldn't.
And if you didn't have this access, you would need to have physicians on staff at the reactivation care center for and to be able to ask questions of. This allows for that connection.
The other thing that it allows us to do is we're leveraging the specialty that we have here. So we have rehab and complex continuing care physicians who work here to provide care 5 days a week and coverage on the weekends via the terminal, which we wouldn't normally be able to do. We would have to recruit new physicians and with an unfamiliar patient environment. So.
Yes. It's Christine Elliott. Does this help you in the course of your daily work with the patients that you're dealing with?
It does. I think that it's a great touch point to ask physicians any questions when there are any questions that are posed by the community.
Terrific. All right.
Oh, thank you, and thanks, Amin.
Yes. Thank you very much.
We'll see you later.
And we're actually going to keep you on there. We're going to take a picture of Michelle. We'll invite you back up, Mr. Corretto and Robin, if you'd like to join at the front.
I'll stand now. So.
Okay.
Stand in front of all of them.
Yeah.
Yep.
All right.
And just let her know if you can take a photo.
Okay, taking a photo.